recording his good afternoon, and this is the Raymond Hall Show. I'm your host, Raymond Hall. I'm here with, I refer to her as my equal host. There's no co here, Mrs. Errecca Flynn Walker. And we have a wonderful guest in studio with us today. We have Mr. Harold Turner, and he's the Director of Programs for NAMI, the National Alliance on mental illness, and he's been sharing some things with us before we came on the air. I want to thank everyone for joining us. I want to thank everyone for taking the time and continuing to support us with your listening and viewing. We are here to talk about service. When you go through this nation's history, you'll see that it wasn't people's contributions through money or donating land. It was because they picked up and said, I'm going to give service. So whatever their talent was, whatever their resources that they had personally, they decided to make a commitment to their neighbor, to the community, and give service. So when we look through history, it's service that has built the nation and continues to strengthen it. We want to talk today about the service of mental health with the Director of Programs and Services with Mr. Turner. But first I want to turn to Ms. Walker and say good evening. It's been a challenging week all the way around.
Yes, it has.
Okay.
But it's been a beautiful day overall. I just want to say good afternoon. My name is Errecca Flynn Walker, and I am the co-host of the Raymond Hall Show. You can follow us at Facebook, Twitter, and Instagram at the Raymond Hall Show at your earliest convenience. We would appreciate you following us and staying in contact with us.
Okay. Now, I'm been educated to understand that that's important.
Very important.
That people follow us on Facebook and Twitter.
We need you to follow us, and we need you to like us. We need you to just become engaged with us so that we can build our fan base, so that we can get the word out about all of the different conversations that we have here at the Raymond Hall Show, which are very vital to our community. Service is
a different conversation. It definitely is a different conversation. When I go back and look at some of the things that's in our history, I was absolutely amazed at some of the things that people endured. Mr. Turner shared with us that he was in the Army, so you know exactly what I was talking about because we stood on the platforms of some of the service of others. And Mrs. Errecca Flynn Walker, I saw she was just elated when she had the opportunity to give her dad a proclamation and pen for his service. You know, service doesn't come with how much you're going to pay me or what are my benefits going to be. It's just something that you give, and most of the times you don't get the benefit. The benefit comes to someone else. It's your service that affords that. So when we see our communities going the way that they're going and we look at everything, you go, well, how is it that the kids have more? You know, the parents have more cars when we used to walk, and there aren't many jobs in our communities, but there definitely are more job opportunities.
Right. And
you look at everything, but the one thing that's missing is service. And so it's not one particular service, a service here or there. Everybody's service counts, and everybody's service makes a difference. Your neighborly service makes a difference. Your service to community, your service to nation makes a difference. And they are not ever going to come up and say, thank you, Mr. Turner, for your service. They're going to roll their eyes at you. Okay? So we just have to know that we're doing the right thing. Mr. Turner is the Director of Program and Services there at the NAMI Urban Los Angeles, and he's dedicated himself to supporting and educating the community about mental illness. So again, sir, welcome, and give us a little bit about your organization.
Well, again, we're the National Alliance on Mental Illness, and we're actually a national organization headquartered out of Arlington, Virginia. It's our national headquarters. And we have state-level organizations that exist in the capital of each of the 50 states. So in NAMI, California is located in Sacramento. And then you have local affiliates. We have about 60 affiliates statewide in California. We have 12 right here in Los Angeles County.
Wow.
And given the size and population of LA County, we kind of have a hybrid organization where we have a county-wide organization that's made up of a collaboration between the 12 NAMIs in LA County to address common issues around advocacy, training, those things where it doesn't make sense to try to attack it as an individual, but we collaborate together to do that. And we all have our own constituencies, our own communities that we serve. NAMI Urban Los Angeles, we are focused in South, Southwest, Southeast Los Angeles, and metropolitan Los Angeles. So it's quite a broad area to cover. And we provide services in a number of areas, and services is the right word because we're probably the largest grassroots organization in the country. There are very few paid positions in NAMI. It's mostly volunteers.
It's a volunteer base.
So when we do that 12-week education course, our flagship offering, which is an evidence-based practice, has been designated as such by SAMHSA and independently verified by the University of Maryland that course does what we say it'll do if we teach it in the way we say the way they tested it. So no matter, fidelity is important to us. So no matter where you take that course, if it's in New York, Miami, LA, or Seattle, it's the same course taught the same way. It's very important for us. It helps us in our fundraising to be able to keep our programs and services free of charge. So there's never a charge for NAMI programs and services to people in the community.
Now, you spoke about SAMHSA. Some of us may know what SAMHSA means, but enlighten the viewing audience. What does SAMHSA, what is the importance of
Substance Abuse and Mental Health Services Administration. It's part of the federal government. That funds these programs dealing with mental health and substance abuse.
All right.
Substance abuse and mental health.
Okay. Well, we are going to be getting into our community moment in a few moments. We're going to take our first break. We just had a little small introduction of the things that Mr. Turner is involved in and NAMI is involved in. He's the featured guest this weekend, so we're going to hear from Ms. Errecca Flynn Walker on community issues, and after the community issues, we're going to delve in a little more deeper with our guest, Mr. Turner. We'll be right back.
Okay, we'll be right back with those community issues.
We are back. The song that you heard is Purposeful. It was a call to service in years before, and because of Mrs. Errecca Flynn Walker, we have decided to play that song as often as we can to have people to remember and rededicate themselves. And Mrs. Walker is going to give us an update on what's going on in the community. What do you have to tell us about?
First, I'd like to say this update is brought to you by the Raymond Hall Show, and we would love to give you this information. I'd like for you to grab a pen and paper so that we can follow up on some information, which is basically giving you the details on where you can make contact with your congressperson or senator to contact them to let them know how you feel about what's going on in the current political climate that we're in. Your California senator is Dianne Feinstein, and your junior senator is Kamala Harris. And you need to pick up your phone and call, because that is the most effective way to make your voice heard in Washington, D.C. You could call the government, govtrack.us. You can go to the internet on that, and then also you can ask to speak to the person when you call. You can ask to speak to the person that is handling I'm sorry. Right now I'm having a moment. I need you to just bear with me.
That's okay. Take your time. Tell us. You need us to contact
I need you to contact your local senator, your congressperson, your governor, by going to Google, and you can Google them and find out anyone that's not in California And also, you can make the phone call. When I was doing my research on this, I found that calling or sending an email is much more effective because you can possibly get someone on the phone. What you do when you get them on the phone is that you give them your zip code and you give them your name, and you tell them what is the exact.
She's so polite, isn't she, ladies and gentlemen?
I know. I'm just on one right now today. You guys have to excuse me. I'm just all over the place today, but I want you to know that it's important that we stay diligent and we stay focused on the fact that we have to be in. We have to be in touch with our leaders. We have to be in touch with our leaders because that's the way that they're going to know that we're here. Next up, I'd like to talk about is the California Women's Law Center. It is the California Women's Law Center and Venice Community Housing free legal housing clinic. And they're going to be having an community event, and that community event will be on Saturday of every month from 10 a.m. to 12 p.m. at the Venice Community Housing at 720 Rose Avenue, and that's in Venice, California, 90291.
And when are they going to be having again?
They're going to be having that upcoming clinic date would be August the 19th and September the 16th and October the 21st. And this is a free clinic. And this
on
is
housing.
On housing.
Okay, on how to get housing or how to stay in the housing or homeless housing?
Yes, it's all of the above. Anything that has to do with housing, this is a free legal clinic and for all the beach cities and residents around those areas.
So the women's league is giving it. Is it just for women or is it men can come too?
Well, all are welcome. If you're a man or a woman, please take the time out to get this information from the California Women's Law Center regarding your housing needs.
Okay. Right.
Okay.
That's some really good information. I want to share. The community moment is Mrs. Walker's corner. I try to stay out of it.
She tries, but today I am.
Let me say this. She tries very hard, and the community both feels it, gets it, and understands it. I'm a little bit more war-torn. And what I'm saying to you is this. She takes the time to put service in so she could help you. Doesn't do any good if you don't get up and help yourself. So when Mrs. Walker asks you to get a pen, get your pen.
Yes.
When she asks you to go to, what's that website again?
GovTrack.us, where you can get all the vital information concerning the people that are representing you in Washington, D.C.
Okay, I got to tell you something. The only reason that the White House is in the state that is in is because you and I didn't put enough service in. Mr. Turner here, he's our featured guest today, and it is so much service coming out of his organization that is just incredible. I'm amazed, and she and I are committed to this veterans organization, and I am continually impressed because she takes it with her whole heart, and she moves, and she works to help everyone out. So her work, the work that's at the studio, the work that Mr. Turner does, none of it does any good if you don't pick up and do your work. Service is not an accident. Disservice is not an accident. Disservice is something that is contrived, constructed, and put upon you. So it will, again, benefit others, but the benefit and the others is not going to help you and your community. It's going to help others in their community. Disservice is when they know that they can build 21 more prisons because they're going to change the law to fit our children into it. That's a disservice to the community.
Right, and that's another whole community subject that's very vital and important. Also, I'd like to say right now that this is the Raymond Hall Show, and we would love for you to follow us on Facebook, Twitter, and Instagram at theRaymondHallShow.com. Also,
if I wasn't Raymond Hall, I'd follow you.
I'm serious. Because Raymond Hall.
Say that one more time. We're going to get you again.
Yes, follow us at the Raymond Hall Show at Facebook, Twitter, and Instagram. And we're here at Morris Media Live in Leimert Park, California, where it's a beautiful studio. And we have our guest here, Mr. Turner from NAMI, the National Alliance of Mental Illness.
Yeah. Okay, Mr. Turner. Now, give us an update on what you all are doing.
Wow, I touched on the 12-week program that we offer. Mm-hmm. We also have a 6-week program that we offer to parents and caregivers of children and adolescents who've been diagnosed or showing signs of mental illness before age 13. Mm-hmm. And unfortunately, that's one of our fastest growing programs.
Wow.
Mm-hmm.
We also have family support group meetings that we have for people who are either new to the mental health world. They have a loved one who's just been diagnosed, and they want to come out and figure out what's going on. What is it I'm dealing with?
Right.
What kind of resources do I need to be connected with? Am I the only one dealing with this? All the things that are on their mind.
Yes.
So they come, and we try to create a safe space, a welcoming space, where their confidentiality is protected, and they can share as much or as little as they choose.
Mm-hmm. Now, this is inside of the 6-week program, or this is another program altogether?
Another program.
Okay.
Family support group meeting.
Okay.
And we hold those twice a month on the second and fourth Thursday of each month. Okay, so we're there for those meetings. We have a number of programs that we have dedicated to people who have lived experience of mental illness, who are on the road to recovery. And those are taught by people who have the lived experience to others to teach them things about how to manage their mental illness, nutrition, relapse prevention, how to advocate for yourself. So we're very proud of that. We also have some school-based programs. We have for the middle school level and high school level even, we have something called Ending the Silence. And this is to get kids, it's stigma reduction. To get them to understand early onset mental illness, what it looks like, how you might identify it in a friend or a family member or even yourself, and who do you approach, to get help with that.
And that's the Ending the Silence.
It's called
in the high
Ending
school.
the Silence.
Okay.
And basically you go in school and you take a 50-minute health period.
Okay.
And you talk to all the kids who come through that.
Okay.
So, and we have another program that we have called NAMI on Campus, and this is at colleges. At NAMI Urban Los Angeles now we have 2 NAMI on Campus programs, one at USC and one at Cal State LA, because most of them are, just like my daughter, diagnosed in college. This is a period of change and upheaval for a lot of young people. Many of them away from home from the first time. We get calls from all over the country, from family members who have a loved one here who's at SC or Cal State L, one of the other colleges in the area, and is experiencing some mental health difficulties and trying to get connected with resources out here. So the focus of those programs, because college kids are busy, is stigma reduction and awareness raising on the campus. And we support them with, having activities on campus, speakers, things like that to bring the awareness up. So, and we also connect with whatever resources they have on campus. Usually there's something like disabled student services or something, and we look at them to see what kind of policies and processes they have that will help people be successful, and also what services are available in the adjoining communities that can also be accessed to build a support network around the person.
Now, the stigma, is it also a medical diagnosis? And if it is, are services afforded under the Americans with Disabilities Act? How is that bridge from diagnosis to
Well, fortunately
resources?
in California, we had something called the it's now called the Mental Health Services Act.
Right.
We knew it as Proposition 63,
right.
or the Millionaire's Tax, or whatever. And in that, monies went into a pot to address mental health issues in the state of California. In early on, that money could be spent in 5 areas. One of them was called prevention and early intervention. And the bulk of those activities, probably early on, most of the expenditures went into that category. And that was geared at awareness raising and reducing stigma. Because the number one reason why people don't access services is because of the stigma. So a lot went into that. If you can't prevent it, the EI on that is early intervention. What does that look like? What do you mean when you're with early intervention? So actually, they funded several different models of intervention in different communities. It was actually in 5 areas, I think, in the African American community, the Latino community, the Asian Pacific Islander community, Native Americans, and LGBTQ communities, to look at barriers and how to reduce those disparities in care in those communities.
Do you have certain parts of the illness to be onsets at different periods or different ages in a life? In other words, is an aged person more susceptible to get one specific type of mental illness?
The bulk of the diagnosis take place, like I said earlier, in that 16 to 24 age bracket. What we call, transitional age youth. Now, there's some can happen earlier, some happen later. But the bulk of them are in that age range. There are a lot of the science is just getting there. We know nothing about mental illness until the 80s. This is still a very young science.
It is.
We're just learning the right questions to ask.
Right.
And to be able to parse the data that we've collected over these years to hopefully point us into fertile areas for further research.
Now, a person returning from service who has encountered a trauma, and you go into the VA, and then they talk about PTSD as it was a traumatic event.
Disorder.
It's stressful, and that stress has risen to a level of disorder. Is that counted inside of the mental illness that you all treat, or is that totally something different that is for the VA to deal with?
Yeah, but let me be clear. NAMI, we are not a direct provider of services. Our focus is on the families of people who are ill.
That's very good. That's very good to know.
And
focusing on the family.
Because we're not a federally qualified health center, nor do we, have the professional designations to do that. But we're family members, just like others. In keeping with your theme of service, that's how we survive. That's how I went through the program. It was such a benefit to me and my family. I volunteered to become a participant right away and went on to teach the class and then become a state trainer to train other teachers and to do all that. And it's what we do in that 12-week class. By week 4, I know who has potential in there. Who has the skills, the training, and the desire. And I start to lean gently on them. By that point. Service needs a little nudge once in a while.
Yes, it does. That's a very good point. That's a very good point. Service doesn't need a nudge.
So now you say it's for the family.
Yes.
So when the family identifies someone that has a onslaught, an episode, then the best place for them to come, for the family and for the person that's suffering, is to NAMI.
Yeah, but that doesn't often happen. Amazingly, a lot of people haven't heard of NAMI.
Yes, no, they haven't.
So what we do, the way we approach our service, is by partnering with those who do.
Okay.
We won't know. We have a strong faith-based partnership, with the West Angeles Church, New Testament down on Florence, Shabbat Foursquare Church over on Florence. And by the way, all of our services are available in Spanish and English.
Okay.
We have partners in the faith-based community, El Apocinto Alto.
We need to get him on
in
Central
Boyle
Avenue.
Heights,
We need to get you down at Grant AME on Central Avenue.
So
everything we do in the handout that I prepared for you on the left side is all of our Spanish-based programs.
Okay.
Well, it's a sampling of the services that we offer there. But that's the social justice aspect of these illnesses. We know what we go with. We know what we go through when we have a family member who's ill. And they can cause a lot of havoc
in the family.
and
Yes, they
chaos
can. And what about
in a family.
Right? What about for the person that doesn't want to address it themselves? Like you have a family member and you see that they have a problem. What do you guys do for that person? Like when they don't want to get help, they don't want to take the medicine.
Well, that's part of what we do in that 12-week education course.
Okay.
We talk about the biology of the brain, how it works.
Okay.
We talk about all the major mental illnesses and their subtypes. We talk about medication side effects.
Right.
We do an empathy workshop, so you understand what it's like to deal with a mental illness from your ill relative's point of view.
Right.
We do a communications workshop. How do you talk to somebody who's psychotic and making no sense?
Right.
We do a roles workshop. Because everybody can be living in the same house, but they're having a different experience based on their relationship to the person who's ill.
Wow.
It's a very, very different relationship for a sibling than it is for a parent.
Yes.
And if the ill person is a spouse, or a child, those are all very different things. And they react
Different
differently.
perspectives for each.
So we address that, and we address, it's, how do you, a lot of people don't want services because of the stigma and other things are there. And we teach them how to approach those things empathetically.
Okay.
Because ultimately, the person who's ill has to decide he wants more out of life than he's getting.
Right.
But, you can help them to do that. But
now, how often are you all open? And if you're not open, if the office is not physically open, how does a person contact you to get help?
Well, our number is 323-294-7814.
Say that one more time, please.
323-298-7814.
298-7814.
Okay. And that's NAMI.
And our office hours are Monday through Thursday, 10 to 4.
Okay, 10 to 4.
Okay? And you can leave a message. Someone will get back to you. You can also go to our website to get information, and that's www.namiurbanla, all one word, .org.
Okay.
And we handled last year over 6,000 calls in our one little office.
And the one in Leimert Park where you are.
The one in Leimert Park.
Wow.
And that's
6,000 calls.
6,000 calls through there.
So that means there's a lot of people being touched by this particular illness.
A lot of them, and that's the 6,000 is total calls coming in. Some we lose. We actually went through a voice over IP system, so we'd be able to track and categorize to kind of figure out who we're missing, if anybody, and we follow up with everyone.
Okay. What about the mental health treatments? We know that there's side effects and there are a lot of causes and reasons why the person, they don't want to take the medicine. So, how do we address that?
Well, again, that's something we address in our classes too with our family members.
Okay.
Because it's a sales job.
Okay.
Because the bottom line is, with these, unfortunately, about half the people with mental illness get misdiagnosed. Sometimes people will go through different doctors for 10 years or more with the wrong diagnosis.
Right.
If you got the wrong diagnosis, you've probably taken the wrong medication. And the problem with medications is it takes them 4 to 6 weeks to be effective.
Exactly.
People decide too early that they aren't doing anything and quit them. But on the other hand, if it's the wrong medication, you're getting all of the side effects and none of the benefit.
Right.
And plus, they have you in their face talking about taking medication.
Exactly. Right.
So we have to teach them to do the thing. We have to convince our family members of just don't make the decision unilaterally.
Okay.
Right.
Whatever discomfort it's causing you, let's talk to your doctor about it.
Okay.
Let's tell him. Let's see if he can't prescribe a different medication with a different profile.
Okay.
Right.
Okay.
But let's not do that.
But you have
on
to
our
have
own.
the correct diagnosis first. And how
You have
do you?
to start with that, and that starts with the family member because.
Okay.
You're the expert.
Okay.
You knew them before they were ill.
Yes.
You know symptoms from personality.
Yes.
Right.
You know what's been tried and what has worked and what hasn't worked. You know what are triggers. This is none of the stuff a clinician who
Would
may
know.
be treating your family member knows. You are the custodian of that history.
Okay.
Right.
So we urge family members to document that
Okay.
and write it down in a succinct form because nobody's going to read somebody's medical charts for 20 years.
Right.
Right.
So we get them to do that. And,
I think a lot of times that the doctors are just too quick to do
Diagnose.
I was in a doctor's appointment a few days ago, and the doctor says, "Well, your other doctor retired."
Right.
And say you were on Prazosin and Sterilin, and I remember how it used to just tear up my days. I didn't have the nightmares anymore, but I didn't have anything anymore. I just
You were numbed out.
You were numbed out. Okay, and you say it's got to be a balance
Right.
between life and living the way that they want you to live.
yeah.
So my question is, with NAMI, do you all recognize the desire people have to A, get better, but yes, live the best life they can possibly give? Because too much medicine is just...
Medicine is just one aspect of it.
Okay.
When we talk about mental illness and mental health, we're talking about 2 points on a continuum.
Okay.
These are not
Just
diametrically opposed
snapshots.
things.
Right.
It's the same thing. In order to be well, people need to be psychologically stable.
Yes, they do.
They need good nutrition, exercise. They need a supportive network of family and friends, and they need something to do with their lives, a reason to get up in the morning.
Yeah.
That's true.
That's what everybody needs. Of those things, the only place where the person who's ill differs from us is the psychological stability piece.
That's all.
Everything else we should all be working on.
Right.
Sometimes they need help with that piece.
Okay.
It's not as easy for them to get back on the right track with themselves, and they'll most likely need medications for that, to help with that. But that's the only difference.
That's the only difference.
And just because you haven't been diagnosed doesn't mean you're not diagnosable.
Wow.
So there are a lot of us walking around
with some sort of
diagnosable mental illnesses.
Yes.
Okay. We're going to shift for a minute on our next segment.
Okay, very good.
And we were talking earlier, ladies and gentlemen, about the amount of resources in the community.
Yes.
Mrs. Walker and I, in the time that we've been here, we've had some very interesting guests all talking about service.
Yes, we have.
The city firefighter told us how even here in Los Angeles there's a need for more minority firefighters.
Right.
We found out so much about in-home supportive services through the persons that visited with us. And now we're here with Mr. Turner. And Mr. Turner is talking about things in the community, and we aren't hearing, well, you got to have the Affordable Care Act. And you got to have to hear that. Is that the case? Do you have to have some type of insurance? When we come back, we're going to shift gears, and we're going to talk about the services that are available through NAMI and just how does the community access those services. We would like to talk to our viewing and listening audience. In the upcoming weeks, we are going to have an open line where you'll be able to
call in and make a comment or just suggestion, or just engage with us regarding the subject that we're talking about right now, which is very, very important, and it's vital. The mental health of each and every one of us. At some point in time, we all feel like we're gonna need some help. We're gonna need some help.
So we're gonna talk about all of the services that's available for us, and let's see if we can't kind of expedite putting that call in together, because I would imagine the community would have a lot of questions.
Yes, I would too. They would like to talk to Mr. Turner right now.
And unfortunately, because we don't have a wide call-in set of numbers, what we ask you to do is to give your question or comment and take your answer offline, or hang up the phone, in so many words. So the person, our guest, can answer your question. You can call the number we're going to set up where you can call and open the studio. You will be calling into our office, and normally, as Mrs. Walker say, get your pen ready, because that number is 323-841-7365.
Okay, that's
so
the number.
You would call into our office number and make your comment or question, and then hang up to allow someone else to get a comment or question in, and we'll go from there. So we're going to take a quick break, and when we come back, we're going to open that number for a quick second.
Okay. Where someone can call, we'll be taking calls, and we'll be right back. And again, before you go, let me just say that this is the Raymond Hall Show, and we would love for you to follow us on Facebook, Instagram, and Twitter at the Raymond Hall Show. Thank you.
Okay. So if you have a pen, 323-841-7365. Call in on that number and take your answer offline, and we'll see if our guest, Mr. Turner, who's the Director of Programs there at NAMI in the Los Angeles community, can answer your question. We'll be right back.
Stay with us.
We are back, ladies and gentlemen.
Welcome back, everyone.
Want to thank you and thank everyone for listening to the Raymond Hall Show. We have a dynamic guest with us today.
It's been an honor to have Mr. Turner here on our panel today, because he's given me so much insight and information concerning the National Alliance of Mental Illness. They're right here in our community at 4305 Degnan Boulevard, Suite 104, Los Angeles, California, 90008. Their number is 323-294-7814, and you can come right over. Right here off of Crenshaw and Homeland is where they are, in the beautiful city of Leimert Park, California.
Mm-hmm. Now, so you mentioned a 12-week program.
Yes.
Mm-hmm. How does a person know when they may need that 12-week program? How does a person know when they may need the 6-week program? I mean, what could be happening that they would know and know to call you?
Typically, people start with our support groups, try and figure out where they are, get their bearings, and try and normalize what's going on in their life. And then after that, they're open to the education piece. But first, it starts with the awareness piece. A lot of times that can happen either by an in-office visit or happens over the phones many times. And people can register for our courses online. They can do that as well, or they can call the office and we can register them and sign them up for it. But
so what could be happening that a person would want to call and register for the course? I mean, what possibly could be happening that if a person was listening to us now, what could they hear to say, something, I need to call?
Right.
I'll give you an example I use with my classes sometimes when I teach classes. I have a phobia about heights. And it affects me physically. If I get too high, I lose control of my extremities and everything. And it bothers me, especially those high overpass.
Right.
I'm like a little old lady. I drive 40 miles, But it's not a problem for me because I can map routes around the city where I avoid those things, and it doesn't affect me at all. But if I lived in Wrightwood or in the mountains somewhere, and I had to drive down the mountain every day to do work, and I couldn't do that, you know, to make a living, to feed myself and my family, then I become clinical. I need to see. I haven't changed. I'm the same person. What's changed is my environment.
The environment changed.
You know, so it's the same with when something adversely affects your life, your peace of mind, it's time to seek help. You know.
Now, ladies and gentlemen, when he said these old ladies, direct your comments to Mr. Turner at.
He said he, okay? He didn't say you or I. He said he. When he runs into these circumstances, situations that make him a little easy or uneasy, he may, you know, take his time out. And we all have those opportunities and times when we have times when we feel
She's so
uneasy.
polite. She's just really polite. Okay, I just wanted y'all to get it straight. I didn't say old ladies. Okay,
and
so don't call me on the Facebook saying, Raymond, you're wrong. Okay, all right. So it's the family that can identify when something is wrong.
Absolutely.
And the family can call, and then when they call to talk about what's going on and what's wrong, that's when your office can say, okay, well, this program may be a better fit for you at this time.
We'll go through some scenarios with them, you know, to find out where they are now. You know, when was they first diagnosed? How long have they been ill? What were they diagnosed with? Are they currently getting services? You know, are they in school? Are there school issues going on? Oftentimes, there's no diagnosis at all. It's just a set of troublesome behaviors. And that's especially true with kids usually. With kids, they don't hang adult-type diagnoses on them like schizophrenia, bipolar disorder, or, you know, they have oppositional defiant disorder, conduct disorder. You know, ADHD is more behavior-related kinds of services because they don't know at that point the brain's still developing whether they're going to grow out of it or not. You know, so we work with them. You know, it's based on need, so it's quite a bit of talking to the families to try to figure out precisely what they need. Okay.
So now if an organization wanted you to come out, let's say somebody was having a community fair, and they wanted you all to come out and be a part of their community fair, what do they need to do in order to reach out to you?
323-294-7814.
And just say that they're having a community fair and they would like for you all to come. And you would come with all the resources, the printed material and that kind of stuff?
Materials and to do outreach for our services right there.
Wow.
Oh, now let's touch a little bit on the justice system and the mental health. People that coming together. Like if someone is experiencing an episode and you call the police, when the police comes, that's when the breakdown can happen because they're not really equipped to deal with the person that's experiencing this episode at this time. What are we doing and what is NAMI doing? I read a little bit about, you said that you were advocating for changes in the justice system.
Yeah, actually we're involved with training both the Sheriff's Department and LAPD.
Very good.
There are about 48 different smaller departments and stuff in the county. It's more than just, you know, LAPD and the Sheriff's Department. But, you know, so, you know, we have work to do there, but many of them get their training and services through LAPD or the Sheriff's Department. And we work with them on giving them a family perspective on mental health. It's kind of an exchange, you know. So we have this information that we give to families called what happens when you call 911.
Oh, very
you know,
good.
tell them what to expect, what's going to happen when the police arrive, because, you know, you don't get a pass because mental health is involved. All these other things, all of the racial things that go on in the
biases and
biases are still there. But we tell people how to do your best to mitigate all those things before something happens. Like, you know, if you have a loved one, you may have to end up calling the police. A lot of people don't want to because I don't want my kid shot. You know, kind of deal. That's the idea. So the idea is, you know, go to the police before. Look, I have a mentally ill son. I may have to call you. You know, sometimes in his psychosis, he can get aggressive. There are no weapons in the home. I remove those. As much information as you can do up front, the better.
So that's why you guys need to communicate together. So that's why you need to be more in tune with the people that are in your neighborhood, like the police and the sheriff. That's why we need to work together, like
Absolutely.
you said.
And we do, mentioning service. There's this collaboration we have actually started out of the Department of Mental Health.
Okay.
It's called Health Neighborhoods.
Okay.
And they exist on a model basis in several neighborhoods. And these are people who are involved in mental health, law enforcement, mental health services, homeless services, food banks, WIC. Doesn't matter what it is, but it's to let everybody know in that collective what other people are doing and what services they provide and how to contact them to do that.
Right, but how do we bring it all together? I mean,
But this is the point where it comes out. It really sets up as a cross-referral system.
Okay, cross-referral.
Okay. I come in and say, wow, like they say she's got mental health issues and she's got kids, she may not be able to provide for, let me call WIC people. What do you do to help people here like this? Can I do this for you? How can I get you connected with this person, to do that. So the idea is to create that collaboration between us. And it's still early, but it's been very successful.
Okay.
Matter of fact, I was skeptical of it at first because usually when people are serious about something, they put funding behind it.
Correct.
But this is a non-funded event, and I'm elated that I was so wrong about how seriously people have taken this.
Yeah.
And we meet once a month and share information.
One of the
go
things,
through vignettes about somebody takes something from their case files and see how many of us it would touch on.
Right, from that one case.
From that one case.
Okay.
Yeah.
There were 2 points before we completely run out of time. At one point, the county had the Genesis team.
Yeah,
and now was NAMI a part of the Genesis team? The Genesis team is that if someone was homeless, there was a time when they didn't just come out and arrest you, criminalize your state of non-permanent housing. They would come out with social workers and police and mental health people and all those kind of things. And they would try to give you the help that you needed right there. Now is that team still available, and are you all a part of it?
There's still a number of things. We're not a part of the Genesis team now is directed at the older adult system of care.
Okay.
And their focus is on older adults. That's the way the Department of Mental Health breaks down its services into age groups.
Okay.
You have children and adolescents there to 0 to 15.
Okay.
And you have transitional age youth, 16 to 24, adults, 25 to 59, and then the older adult system of care, 60 and up.
Okay. So the Genesis is found inside of community and senior services?
It's inside of the older adult systems of care. And that's the team that deals with that. Now, what you mentioned to me sounds like what we have it's actually called right now it doesn't have a better name. It's named after the legislation that created it, but it's an SB 82 team.
Okay,
and they do homeless outreach and Christian community. They have mobile teams that go out and connect with people. They can put them into shelters or buy them a meal or try to get them connected with services to get them off the streets. And those mobile teams are active in all the different service areas.
Now, how do we get in touch with the SB 82 team?
Actually, you would just call that. It's an 800 number, 1-800-877. What is it? Oh man, you're gonna make me get it wrong. I turned my phone off.
Well, we'll definitely have that number of the
County
SB 82
Crisis Hotline, or you can call 211,
and
they'll give you the number.
And you just say SB 82 team, and they'll give you the number.
Yeah, they'll dispatch that team.
Okay.
Yeah.
Now
and they're out in the community to do that. Now we have another service that's fairly, it's been around about 1.5 years now. It's called the Assistant Outpatient Treatment Team.
Okay.
And what makes them a little different than the psychiatric teams that we used to, psychiatric teams you call when someone's having a crisis, and then you're able to, they can take the person and hospitalize them or do something. This is to address the issue of people who are in that revolving door thing,
keep
going
coming
to hospital,
back,
getting out, going to jail, getting out, coming up. But they are required by law to engage with those people for a period of 30 days to try to convince them voluntarily to get services.
Right.
Failing in that, they have the power to take those people to court and get a court order to detain and treat them involuntarily.
And that's the assisted outpatient.
But they have to demonstrate to the court that the person is deteriorating and will continue to deteriorate without intervention. So you have to protect people's civil rights too.
Yeah. Right. Okay. Well, this is a rich and very deep rooted subject matter.
Yes, it is.
Yeah, it's huge.
And
it's huge. Oh my God, it's so huge.
It has been very informative.
It has been.
Yeah. We're running out of time. We're coming up on those last few minutes for the show. What we're going to do is we're going to give you an opportunity before we run out of time to give everyone again your main contact. Please give them your web page and your telephone numbers, and we're going to turn it over to Ms. Walker so she can get some last moments here. So what is your contact information?
So again, we're NAMI Urban Los Angeles. That's the National Alliance on Mental Illness, Urban Los Angeles affiliate. We're at 4305 Degnan Boulevard, Suite 104. You can walk in or you can give us a call at 323-294-7814.
Okay.
Or you can visit our website at www.namiurbanla, that's NAMIURBANLA.org.
Okay. Well, we want to definitely thank you, Mr. Turner, for coming by and sharing this information with us here at the Raymond Hall Show. And Mrs. Walker, you have always so much going on in the community that we now actually look to hear what you got us.
What we're doing, we just like to say that here at the Raymond Hall Show, we're committed to providing a broadcast that services to communicate to all of us the important, without regard of age, ethnicity, gender, or community. Our motto is service, a different conversation. The Raymond Hall Show objective is to speak with your service. Others will serve and speak. We like to say thank you to Mr. Turner from the National Alliance of Mental Illness for being here on our panel today. Thank you to Mr. Hall. We like to also say that our broadcast at the Raymond Hall Show is live every Thursday from 2 p.m. to 3 p.m. Pacific Standard Time from the Morris Media Studios located at 4309 Crenshaw Boulevard, 90008. Follow us on Facebook, YouTube, Twitter, or our podcast at The Raymond Hall Show. Thank you so much. My name is Errecca Flynn Walker, and I look forward to speaking, seeing, and hearing from you next week, this same time, 2 p.m.
Well, I want to thank you again, and I ask you to follow us and do everything that you can. It's important. I want to share something with you. I sometimes laugh with Mrs. Walker, and sometimes we kind of roll our eyes at each other because it's without her, this broadcast would not go on. I must tell you, people walk up to me and say, 17 years, you had a heart transplant 17 years. I thank God for each and every day he gives me. Some days, a little more challenging than the others. But she steps up and puts up the service that's required for this show to go on. I also want to thank Miss Felicia Morris, because here at Morris Studios, without her doing what she does in that booth, we would not be able to bring this message of service to you. It's absolutely vital that you pay attention. Go back and look. Everyone, whether you believe or not believe, that's not the focus of this statement. You go back and look at all of the books, the truth books that it talks about when someone created something. Everybody created everything before they created mankind. And then they created mankind and told mankind to take care of it. In other words, a greater force had service for we who were created. That's us. That's you and I. And over the years, over the decades, over the hundreds of years and everything else, people have given service, and they've given service not with what they didn't have. They gave service with what they did have.
And sometimes you got to nudge them a little bit.
Yeah.
As Mr. Turner would say.
Because they gave service with what they did have, we are here to be able to have the opportunity to continue in service. Mm-hmm. If it had not been for the advocacy of National Alliance for Mental Illness, we would still have some of the draconian things going on with the mentally ill that we had in years past. If it was not for the strong strength and commitment that Mrs. Errecca Flynn Walker, and others have to service, we would still be light years away from where we are today. You know, your service may just be a smile and a greeting. That's what's called for. Your smile, your service may be something a little bit more. But no matter what your service is, you have to give it, because your service is not for you. It's for someone else. It's just given through you. So we want to thank you here at the Raymond Hall Show. I'm going to say to Mrs. Errecca Flynn Walker, thank you so very much. I want to say to Mr. Turner, thank you so very much. You all keep doing what you're doing, because I'm like Dr. King now. I'm okay. Well, no matter what God tells me to do, I'm okay. But it's important that I do something about what I've been given. The life I've been given says that I'm supposed to do something with it. All that means is I'm supposed to have a little service. So thank you, and follow us where?
On Facebook, Twitter, Instagram at The Raymond Hall Show. Thank you.
Thank you. Have a good night.